Welcome back. My next guest is Dr. Brandon Gish, who is an interventional pain specialist with the Lexington Clinic. Welcome.
Thank you.
Now, a lot of people have pain of various sources, and a lot of them end up seeing you. Tell us a little bit about what is an interventional pain specialist?
Sure. Thank you, Dr. Fox. We obviously treat pain, but we take a modern approach to that. So this is not pain management of the past. I see patients commonly that have concerns about seeing me. They're afraid we're going to put them on medication or we're going to mask their pain. They want to know what the problem is. And that's exactly what we do. So I found that encouraging. So we may use imaging, we may use diagnostic injections to identify what the problem is, and then utilize that to create a treatment plan that sort of best suits their goals and physical function.
And those treatment plans you mentioned are not always pills or narcotics, they're other interventional areas.
Absolutely, yeah. So we work closely with other specialties. It obviously starts with physical therapy or home exercises, and so sometimes we'll perform minimally invasive injections to assist with the ability to do that. The body has a natural way of healing itself in that way. Sometimes we'll use minimally invasive spine procedures, so more than an injection, not an invasive spine surgery, but times call for that, and we work closely with our surgical colleagues in treating those.
Now, you mentioned spine and back, and we see a lot of patients who have back pain. We refer a lot of patients with back pain because it seems like it's difficult to manage, and sometimes it's disc degeneration. You treat that?
Absolutely, yeah. And back pain, it can be lumped into a fairly large category, but it can be debilitating from a mental standpoint, your ability to function in your job, your family interactions, and so it can really take a toll on you. But the disc specifically is an incredible piece of the body. Without it, we are a stack of bones in the spine. We don't have flexibility. We can bear weight, but we can't move. And so it's great that we have the disc in between each of the bones in the spine. It allows us to bear weight, significant amounts, but also maintain flexibility. Unfortunately, it's susceptible to injury, and particularly as our core weakens over time.
And you have a herniated disc, slip disc, whatever term you want to use. Tell us what that is, and there's a new treatment for some of that pain.
So think of the disc as a circular fibrous structure with a jelly center. And if we have in ourselves, we know somebody who has had an injury to that sort of fibrous part. And what happens is the jelly sort of seeps into that area, and the body creates an inflammatory reaction to try to treat that, to heal it. And that in itself is quite painful. And sometimes that lasts a few days, a few weeks, and you kind of get through it. That's the first sign that you ought to be doing something with the core or seeing a specialist to try to prevent the next episode. But when that begins to happen on a regular basis, you can have other things in the spine that become deranged. You get arthritis, you can develop stenosis. If it touches a nerve, you may have sciatica. In its chronic form, that inflammation will sensitize the bones on either side of the disc, and that becomes not a frequent pain, but more of an insidious pain.
And you use a new, relatively new, called Intercept?
Correct. And so when we can identify changes on an MRI that show swelling of the bones from that inflammatory response. So this is a patient that hates to sit, can't lean forward at 30 degrees at a kitchen sink or laundry. Tying your shoes is uncomfortable, that forward bend. And that pain is transmitted from the basivertebral nerve to the brain. And we can ablate that nerve from an outpatient procedure. It takes about 15 minutes for each level. And that's a lifetime of pain relief in that way. There are other ablations we do that you may be quoted 6-12 months of relief. This is a special nerve that does not regrow itself, so it's advantageous in that way.
When you use the term ablation, tell us what that means for folks who don't know.
Yeah, essentially it's we place an instrument or a needle in a location that we'd like to ablate or destroy, and so it uses heat and electrical energy to ablate a radius around the tip of that instrument, and we place that in a location that's where this nerve that we'd like to ablate lives.
It's an outpatient procedure. You're in the same day, home the same day?
Correct. Not something that requires you to go home on narcotics, not anything that we expect any downtime specifically. A couple days of rest is sufficient. No major incision to manage. It's designed to be minimally invasive and get you back to functioning.
Well, that's great information. We appreciate you coming in, appreciate you telling us about it.
Absolutely, thank you.
And if you've got back pain, you may be a candidate, and you see Dr. Gish at the Lexington Clinic. We'll be right back.